I'd just like to share another experience of mine when I'd been to a district hospital and I found that the X-ray was not working, and the reason was very simple. There was a line of X-ray shops outside which were doing all the X-rays, and the X-ray machine in the hospital had deliberately been put out of order. We know this is a very common thing which happens everywhere. So I went after a year or so, I went and I found the entire scenario had changed because of PPP, because a private provider had been asked to take up the X-ray, and it was a win-win situation because he was getting his due reward for his services. The X-ray was working. So that was one moment I think I had an epiphany, and I felt that if the private and the public sector does get together, it really benefits patients, and the quality as well as the standards of healthcare go up. With regard to MMR, in 1990, the MMR was around 600. Now it has come down to 178. IMR and U under 5 mortality have also come down to 42 and 52 respectively, and we are on the way to achieving our MDG goals. TFR has come down to 2.4, and hopefully we will be able to achieve replacement rate shortly. Out of our pocket expenditure, it is up to 70%, and out of 193 countries, our position is 184th. So that is something which we really need to look at. Let me talk quickly about some of the initiatives which we have taken, especially under the new government. A swasthindia.gov.in portal has been set up, which invites doctors from outside to join hands with us in order to come and help us out in hospitals, also in medical projects. And a national health portal is going to be set up, which will have at one stop a lot of information about health. Then electronic health records, we have already used them in CGHS as well as CGHS related hospitals, and we want to unroll this throughout the country. Under the Clinical Establishment Act, we have notified standard treatment guidelines for as many as 20 diseases. Then the new health policy, our health policy was last enunciated in 2002. 12 years down the line, a sea change has taken place, so we are in the process of revision of our new health policy. And of course, all of you know about the establishment of new aims. The intention of the government is to establish one aims in every state, and for the moment, we have taken up 10 new aims for establishment, and 500 crores has been sanctioned for that in this year. One fact which most of you would not be knowing is that we are also expanding our universal immunization program to include rotavirus, rubella plus measles. So expansion of the universal immunization program beyond our 7 diseases, that is also on the anvil. Another thing we are looking at is cross-cutting issues, whether it is trauma centers, we need to liaise with the transport ministry, sanitation obviously with water resources and sanitation, nutrition with WCD so that we can build on the ASHAs and the Anganwadi platform. Education, we need to have school health and a syllabus on school health, we need to unroll that. Another interesting debate which is developing between insurance and assurance. Assurance is a sense of entitlement, giving every person an entitlement to a group of medicines and diagnostics. We are already doing that under the National Health Mission, but the idea is to scale it up. And the other aspect is insurance, for which we have now set up a committee which has been asked to give its report in 6 weeks' time. We are trying now to consolidate and roll out a national level scheme, insurance scheme. It is true that it's a jungle out there, as she said, but we are trying to make more sense of it and bring everybody to the same standard. Thank you very much.